Welcome to this YouTube channel. In this video we are going to talk about the 10 best benefits of vitamin D3. So before starting this video, like this video, and subscribe to our YouTube channel for future updates. Vitamin D, also known as the sunshine vitamin, because of its ability to be absorbed by the body by sunlight, is an essential component of human health. According to the National Institutes of Health's Office of Dietary Supplements, its primary function is to enhance calcium absorption, which is required for bone formation and remodeling when mature bone tissue is removed and new bone tissue is formed. A deficiency of vitamin D can result in thin, brittle, or deformed bones as a result. Vitamin D, on the other hand, has a slew of other advantages, including good effects on both physical and mental health. Here are 9 vitamin D benefits to be aware of, as well as techniques to increase your vitamin D intake in your regular diet. Number 10, vitamin D strengthens your bones. Vitamin D is well known for its ability to strengthen and develop bones. According to Jackie Nugent, RDN, culinary nutritionist and author of the Clean and Simple Diabetes Cookbook, vitamin D improves calcium absorption in your intestines, which allows for regular mineralization of your bones. In other words, without vitamin D, the calcium that helps your bones wouldn't be able to do its function. You need vitamin D for bone growth and to keep your bones from becoming brittle, she says, adding that when combined with calcium, it can help prevent osteoporosis, a condition in which bone density and quality are compromised. Number 9. Vitamin D can help strengthen muscles. Vitamin D is important for muscle strength in addition to its bone-building properties. According to Lana Nasrallah, MPH, Road, clinical dietitian at UNC Health, a lack of vitamin D in the body might increase the likelihood of having weak muscles, which in turn increases the chance of falling. This is particularly critical for the elderly. Vitamin D may assist strengthen muscle strength, reducing falls, which are a prevalent concern in older persons that cause significant disability and death. Number 8. Vitamin D can support the immune system and fight inflammation. Vitamin D, according to Dr. Nasrallah, can also aid in the development of immunity. She claims that it can help the immune system by battling harmful germs and viruses. In fact, researchers are interested in its potential function in infection outcomes, therefore its involvement in perhaps preventing infections has become a significant worry during the COVID-19 pandemic. Its involvement in viral illnesses like influenza and coronavirus is of special interest, says Barry Boyd, MD, RDN, a Yale medicine hematologist, oncologist, and nutritionist. He cites a 2017 BMJ study of 25 randomized control studies comparing vitamin D supplements to placebos, which revealed that vitamin D supplementation, whether daily or weekly, lowered the incidence of acute respiratory infection, especially in people who were deficient in it. Studies show that high latitudes and winter seasons are risk factors for low vitamin D, influenza, and other respiratory illnesses, as well as bad outcomes, he notes. We are now observing a similar pattern with increased mortality rates in COVID-19 infections, says the researcher, adding that more research is needed to understand whether the association is causal or just a coincidence. Number 7. Vitamin D can aid in the maintenance of good oral health. Vitamin D aids in the absorption of calcium, which helps to prevent tooth decay and gum disease. According to a 2011 review published in the Journal of the Tennessee Dental Association, while research is limited, there is an emerging hypothesis that the vitamin is beneficial for oral health due to its effect on bone metabolism and its ability to function. Number 6. Vitamin D can help prevent type 1 and type 2 diabetes. According to Nugent, while studies aren't conclusive, vitamin D may help prevent both type 1 and type 2 diabetes. One study, published in the journal Diabetes Care in 2006, found that while vitamin D alone did not effectively lower the risk of an overabundance of sugar in the blood, a combined daily intake of greater than 1,200 mg calcium and greater than 800 U vitamin D did. Number 5. Vitamin D can aid in the treatment of hypertension. According to Nugent, a 2019 review published in the journal Current Protein and Peptide Science suggests that vitamin D may play a role in the treatment of high blood pressure, one of the markers of cardiovascular disease. Even short-term vitamin D deficiency may directly raise BP, blood pressure, and promote target organ damage, the authors of the review write. Number 4. Vitamin D can aid weight loss. Dr. Boyd points out that obesity is a known risk factor for low vitamin D levels, so getting more vitamin D could help with weight loss. According to a 2009 study published in the British Journal of Nutrition, overweight or obese women with low calcium levels who took a daily dose of calcium combined with vitamin D were more successful at losing weight than those who took a placebo supplement, due to a link between calcium and vitamin D. Number 3. Vitamin D can aid in the treatment of depression. Researchers found a significant relationship between depression and vitamin D deficiency in a 2017 review article published in the journal Neuropsychology. While more research is needed to define the exact workings of it, such as whether low vitamin D levels are a cause or effect of depression, the authors recommend screwing up your vitamin D levels. Number 2. Vitamin D may help reduce the risk of certain cancers. Dr. Boyd cites a number of studies, the majority of which can be found on the National Cancer Institute's (NCI) website, that suggest vitamin D may have cancer-fighting properties. He continues, evidence is growing that vitamin D supplementation may enhance cancer outcomes. Colorectal, breast, prostate, and pancreatic cancer are the cancers for which the most human data is available. Researchers are particularly interested in a relation between vitamin D and a reduced risk of cancer, according to the NCI. According to the organization, some research shows that individuals living in southern latitudes, where levels of sunlight exposure are relatively high, have lower incidence and death rates for certain cancers than those living in northern latitudes, though more research is needed to find a specific causal or correlational link between more sunlight exposure and a lower occurrence of cancer. According to the National Cancer Institute, more experimental evidence shows that vitamin D has several activities that may slow or prevent the development of cancer cells and tumors in mice, including promoting cellular differentiation, decreasing cancer cell growth, stimulating cell death, apoptosis, and reducing tumor blood vessel formation, angiogenesis. Some data suggests that increasing vitamin D3 can help prevent the evolution of prostate tumors, while other studies suggest that combining the nutrient with greater fiber can lower the incidence of polyps, which can lead to colon cancer. Another beneficial combination is vitamin D and calcium. A 4-year study indicated that postmenopausal women who supplemented with both had a 60% lower risk of cancer. Vitamin D has also been researched for its possible association to breast cancer. A study of 166 women undergoing treatment found that nearly 70% of them had low vitamin D levels, leading many scientists to speculate that there could be a link. Number 1. Mood. However, one of the most significant advantages of vitamin D3 is its effect on mood. Because of the synthesis of vitamin D that occurs with direct contact to UVB rays, many people suffer from seasonal affective disorder and are generally happy when the sun is shining. Vitamin D supplementation is not only a mood booster, but it may also assist to alleviate the symptoms of clinical depression. Other therapies may be required, but ensuring optimal vitamin absorption is crucial initially. Where can I obtain additional vitamin D? Despite the fact that vitamin D is readily available through sunlight, some foods, and supplementation, many Americans are still deficient. According to the most recent data from the Centers for Disease Control and Prevention, 2/3 of the population had adequate vitamin D, defined by the Institute of Medicine as a serum 25-hydroxyvitamin D, 250-HD, value of 50 to 125 nmol/L. Because you can't always tell if you have a vitamin D shortage on your own, Cynthia Sass, Rhode, MPH, contributing nutrition editor for Health, recommends consulting a medical specialist. The ideal method is to have your blood vitamin D level checked to establish if your blood vitamin D level is within the adequate range, she says, and if so, the right dosage of supplemental vitamin D. What do you think about this video? Do let us know down in the comment section below. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.